everybody, Holly Cohen, host of the MEDIGAP show and founder of MedigapCares.com, an online website to navigate through the Medicare maze. If you like the video you're about to watch, hit like and also subscribe to the channel. I'm more than happy to have as many people ask as many questions in the comments below as possible, and I also try to provide lots of links so that you know where online to search and what phone numbers you can reach out to get more information on the Medicare process. We're going to go over the Inflation Reduction Act of 2022 and how it affects Part D. The act includes provisions to lower drug costs and reduce spending by the federal government, particularly through changes to the Medicare Part D drug benefit. We're going to give you an overview of the Part D benefit design and cost-sharing requirements for 2023, as well as upcoming changes in 2024 and 2025. The benefit currently has 4 phases. So in the deductible phase, enrollees pay 100% of their drug costs, up to $505. In the initial coverage phase, enrollees pay 25% of total drug costs, and Part D plans pay 75% up to the total cost of $4,660. In the coverage gap phase, enrollees pay 25% of total drug costs for both brand name and generic drugs, while Part D plans cover the remainder and drug manufacturers provide a 70% discount on brands. Finally, in the catastrophic phase, Medicare pays 80% of total drug costs, Part D plans pay 15%, and enrollees pay 5%. What changes can we expect in the coming years? Well, starting in 2024, the catastrophic threshold will be $6,550. which means that enrollees will enter the catastrophic phase sooner and pay less out of pocket. And in 2025, a new out-of-pocket cap of $2,000 will be implemented, which will limit enrollees' total spending on prescription drugs, which is a really nice thing to hear after many years of a lot of complaints about our Part D. It's getting better. Overall, these changes to the Medicare Part D benefit are designed to reduce drug costs for the enrollees and for the government while maintaining access to our necessary medications that are on the market. So I hope this video has been helpful for you in understanding the Part D design and upcoming changes. Please comment below. I'm more than happy to answer any of your questions and your comments.